And the subject of this panel will be at a juncture when self-care seems to bear the weight of our well-being, it's important to explore the untapped potential of community care. Moving towards our inspiring panel discussion on the topic, Beyond Self-Care, How Community Care Fuels Our Growth and Resilience, where the experts will illuminate the powerful role community care plays in promoting growth and resilience. We're ready to unpack the potential it holds in fortifying our collective well-being beyond individual endeavors. To take the discussion forward, please put your hands together for our moderator, Dr. Nusha Nuhi, PhD, clinical psychologist at Marina Health of California, and panelists, Christine M. Colburn, owner and licensed professional counselor of Beacon of Hope Counseling Services, LLC, Professor Dr. Charles Senesi, Associate Professor and Medical Doctor at Afro-European Medical and Research Network, Jessica Brazil, Founder and CEO of Mindful Living Group, and Dr. Rebecca Johnson-Osei, CEO and Licensed Psychologist at Concierge Psychology. Thank you, and if I mispronounced your name, please share the correct pronunciation with the audience.
All our mics are on. Hello, everyone. Welcome to our panel, and thanks for joining us at the end of the day of day 2. It is wonderful to have everyone here. I'm honored with my esteemed colleagues here. We've had a wonderful time discussing this topic and really look forward to having this discussion with you all. I'm going to start out with brief introductions. My name is Nusha Nuhi. I'm a licensed psychologist from San Diego, California. I work primarily in health psychology and provide individual therapy services in outpatient setting and private practice. And we'll have Charles go first.
Thank you very much. I'm very happy to be here. Thanks, Madam Moderator. I'm Associate Professor Dr. Charles Senesi. I'm a medical doctor and a researcher. I'm originally from Sierra Leone, but for the past 19 years, I'm based in Switzerland. And I'm very much passionate about developing the resilience of communities. And as a physician, I did some few studies to back up my ability to effectively deliver. So I have in addition to being a medical doctor, I have a master's degree in dermatology, and I did a PhD in international health research, in health sciences, focusing on international health research and education, and the PhD candidate in public health epidemiology. And I'm also the founder and president of the Afro-European Medical and Research Network. And I've been 30 years in healthcare delivery to low and middle income countries, especially hard to reach communities. And I'm very happy to be here on behalf of AMWEN and the diaspora organizations in almost every continent around the globe. And we are very much focused on accessing health to communities that are very hard to access the health, both in high income countries as well as low and middle income countries, especially sub-Saharan Africa. So I'm happy to be here and you hear more about our work. Thank you.
Thank you.
I have to follow that up, huh? Thanks. I'm Christine Colburn. I am a clinical, I'm clinical, right? A licensed professional counselor, a national certified counselor, and a certified clinical trauma professional. I love titles. I have a private practice in Mesa, Arizona. We focus mostly on the grossly underserved population of children ages 3 to 17. Although we do work with all age groups for general mental health. With the children, it's trauma. We work with LGBT groups, trying to provide safe places for people to just be able to talk and come out. And if they don't have support, they can build their own community and support system for them. And then with the children, they're the seeds of our future. And if we can get them help now and give them the tools that I know back in my day I did not get, they're going to be way ahead of us and have a much brighter future having the coping skills they need just to get through day-to-day living. I mean, I believe we all have those within us already. We just all haven't been taught to use them. Yeah.
Aloha. My name is Jessica Brazil. My aloha reveals to you that my career has primarily taken place in the state of Hawaii. I have been in the field of social work for over 20 years, working on a state level, a nonprofit level, an educational level, and in the last 15 years has been primarily in mental health. I began a multi-specialty private practice group made up of a variety of professionals, primarily in mental health. And we provide an integrative, holistic, and spiritual-based practice for serving statewide through 3 clinics and a statewide telehealth platform. So this topic is near and dear to my heart because our group actually formed through community building and through self-care support groups. So I'm honored to be here, and thank you so much.
We have so much in common on this panel. Okay, I won't totally repeat what I said earlier. I'm Dr. Rebecca Johnson Osei. I am a board certified clinical psychologist and I own Concierge Psychology, which I can say a little bit more about. So it is a private practice also. We mostly serve high functioning adults. It is what we call sort of a luxury mental health practice. It's all private pay, which is a little bit different. For being on a community panel, I realize. And we serve, I think we're up to 42 states at this point, but we have offices in LA and Atlanta. But just professionally myself, I've done a lot of work within community mental health historically. And I also think regardless of where we work, there's just so much overlap, right? The community is impacted by the individual and vice versa. And I think the healthier our communities are, the healthier our individuals are. So I think it's really important that we give appropriate attention to this topic.
Excellent. That's a perfect segue to our first question for our panel.
You're welcome.
Thank you. So, what does community care mean to you personally, and how does that align with your line of work? Charles, would you like to start from an international perspective?
Okay, thank you very much. Yeah, of course, I can give it a try. Community is very much dear to our hearts, and by definition could be a group of people sharing common characteristics, living together. And so having the community access the help they need is very crucial in the healthcare delivery, especially the communities, the end users that are way down the healthcare delivery chain. And that's what we at the Afro European Medical Research Network do. We leave our comfort zones. We go to the last communities in the healthcare delivery system in low and middle income countries. So at least we can stimulate that health-seeking behavior among them. We can optimize their health awareness so that they can become more resilient in their healthcare-seeking behavior. And then we live with them. We actually try to help them as much as possible while we address their common ailments. And we don't only stop at that community level. We also go a bit further up in the community healthcare delivery system, maybe at the tertiary hospital or at the government level in the country specific. And we try to make sure that there are policies that align with efforts in actually making sure that people in the last end of this healthcare delivery chain receive the healthcare that they need. Professionally, as a physician, I'm a big fan of personalized medicine. I did my PhD dissertation on the tiny mutations in the enzymes that metabolize the medications in HIV/AIDS patients. So that's how I went to the nitty-gritty. But I highly respect the need to work as a team. Indeed, as the African proverb goes, that if you want to go fast, you go alone. But if you want to go far, you go as a team, which is why the motto of our network is together we can make it happen. So whilst looking at healthcare delivery at that community level, we try to empower the government community of policymakers in the country specific where we work. And we don't only stop there, we work at the regional level, even with the WHO AFU, to make sure that the policies of the WHO, which is the custodian of the health of the world, flows right down to the country level. And then we come back to Geneva, to the WHO headquarters, where I at times work as a consultant for the WHO to make sure that the policies of the WHO actually fit into the needs of the healthcare delivery countries down to the last community level. And I go up to the level of the United Nations. The WHO is a sub-agency of the United Nations. We are United Nations accredited to make sure that the policies are well understood by the last man in the healthcare delivery system. So therefore, the community medicine, the community healthcare delivery does not only stop at what all of us are doing, but we should be able to use the bottom-up approach so that we appreciate. Because at the United Nations, they depend a whole lot on what is fed from the local community in the how we call it, the bottom-up approach. So I'm very much a fan of that. And then in as much as I go down to the last healthcare delivery system, I also try to influence things from the global level. And so it's nice for us to know that we are never small to make a change. Whatever little work you are doing has a ripple effect in supporting the WHO and the United Nations Sustainable Development Goals. Thank you.
Always hard to follow. Now I lost my train of thought.
I'm so glad you're next to him.
Yeah, thanks. Mike, you want to switch?
Here, I'll reemphasize the proverb that Charles shared. We were talking about this last night. It's just so wonderfully and perfectly put with our discussion. So if you want to go fast, you go alone. If you want to go far, you go as a team. So we'll continue with that.
I'm going to adopt that. Is that okay? Okay, awesome. I'm like, I don't even know how to follow that. So mine's at a much smaller level than Charles. Thanks, Charles. I started out working with the Native American population, and I learned a whole new understanding of what resilience means. And for probably about 8 years, I worked with Gila River, Salt River, and Auction Native American reservations in Arizona. And actually, they show a lot of community care out there. And it's doing things without being asked and not expecting anything in return. And I would watch the communities just really come together for each other. Even after being out there for a while, they finally accepted me. And, I went into their homes and schools and their works and to do therapy with them. And if they felt like I wasn't eating enough, here, you need to eat. And I was like, I'm not hungry. But it's, I guess that's where I learned a lot about community care and how beautiful it is. And I think if everybody just one act of kindness each day, how much different our world would be. Is that going to be something that can happen? I can only hope. And it's better than not having hope. But it's, I think it's always important to smile. I make eye contact with people, and I'm always looking. If they make eye contact, then I'll say hello or good afternoon. And I actually had a woman, I was running late for a meeting, and I ran into McDonald's to use the restroom. And of course, I'm one of those, if you use the restroom, you gotta buy something. Coming out, she stopped me, because on my way in, I had said, oh, good afternoon, and kept rushing by. And on my way back, she stopped me, and she said, you saw me. And I said, well, of course I did. And she's like, no, you don't understand, I'm homeless. And she's like, I was sitting here contemplating suicide because people walk by me, they won't look at me. And if they do, they look down at me like they're better than me. And I felt invisible mostly. And she goes, but you looked at me, you smiled, and you said, good afternoon, like I was a person. And I said, darling, I said, you are a person and you do matter. I said, you're here for a reason, but you have to know that. And she's like, I'm going to change my life. I'm going to get better. I know I'm not invisible now. And it was just one of those moments. It took 2 seconds, walking by, smiled, made eye contact, and said, good afternoon. And then for her to tell me that, I was just like, oh my gosh. And so now it's really something I do every day because we really don't know the stories behind those smiles we see every day by people. Like I work with children primarily, and they're like, oh, this kid is blah, 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 blah. Well, children don't just act out. People don't just act out to act out. There's something they're not able to regulate within themselves, and they don't know what to call it or how to describe it or how to share it because they haven't been taught to use those tools. So anyway, it's those simple acts of kindness. If we all could just do that, even to ourselves. I mean, when's the last time anybody's looked in the mirror directly in the eyes of yourself and said, hey, I like you? Most people can't. It's so uncomfortable. But if it's uncomfortable, there must be something you're not liking coming back at you. And you can change that. Our minds are so powerful. And it's, I don't know, pretty great. But I teach a lot of the clients, I encompass the families, and I teach them all how to communicate and learn how to hear each other and understand, like, the children aren't you. Don't say, "But as a child, I did this," because they're not you. They're an individual. They're not their brother. They're not their sister. They're an individual, and each child, each person, you have to adapt to the way they learn or hear or take in information or teach information. And it's just human kindness, really.
Well, that was beautiful. Thank you. I feel so inspired hearing that story. Thank you. It like touched my heart, which really brings us back to, from my view, community care is all about building healthy communities. And that starts with our view of how we view other people and our value for collectivism over individualism. So from my perspective and in living in Hawaii, where we still have a strong indigenous cultural value that is weaved into our community and culture, this value of hanai, of ohana, of hula. This concept is called imua. When with paddling canoe, one of the biggest values with community is everybody is paddling together. And it's not just that we're paddling together, we're actually paddling at the same pace. And when we're paddling at the same pace and everybody is doing their best in their role, it's a very light flow. The boat actually feels really light and you can go really far. It's pretty amazing. So when it comes to community care and building community in my own business and in my own practice, the focus is very much on how do we build strengths and how do we position people within our group in their roles of strength so that we can all paddle with a little more grace and ease, not necessarily harder, just smarter. And we can have that lightness that comes from being in community with one another. The nuclear family isn't able to do it all. Our political system can't do it all. And we see this container that has all these cracks in it and all this energy, this money, this attention that we're putting into a system that has a lot of cracks and crevices. And from my perspective, community care, we could reference a lot from indigenous cultures that allow us to fill in those cracks and those crevices a little bit more through these tribal or hanai, which is similar concept to adoption, extending our resourcing out when we are full and overflowing, that we allow our concept of family and community to stretch out a little bit farther. And that can happen in the workplace, family, nonprofit, state. There's just so many ways that that can be expressed.
Just to add to that real quick, because in the Japanese culture, any like bowls that break, they'll take gold to fill it and reseal it, and it's actually stronger than it was before it broke.
Oh, that's beautiful. So we have so much we can learn from some of these traditions. And that's one of the things I love about multiculturalism and diversity and having that in our different environments, that we can learn from each other in ways like that.
They're pretty good, huh? You guys are great. I'm like, ohana means family. Lilo and Stitch. This is how you know I have children. But like, I cried at that scene. So it's picking up on some of what you guys said. Recently, I occasionally, the news occasionally hits me up and says, hey, why are people shooting each other? Why is this happening? And you've probably all noticed that there seems to be more reports of violence happening in general. And we all know some of that is media skew and access, but there does actually seem to be some uptick. And I think it goes all the way back to the community support piece, right? Regardless of what may have initially led to having a huge number of people in their 30s and 40s who don't know how to emotionally process, which is interesting from a mental health perspective. But it's where we are. And that community support piece. How do we support people like the person in the restaurant? How do we help each other to be better, to cope? How do we notice when somebody else is falling apart and fill them in with the gold? Make them bigger, stronger together. I think as a society here in the US, we do have very much still a bootstrap mentality. If something is wrong, you fix it. And if you can't fix it, well, you suck. Pretty much, and that's been really hard. And I do think we're finally kind of coming around and realizing maybe that hasn't been the best thing for our entire society. Sort of all the way back to that first quote, doing something alone may get you there quickly, but you get there better when you help each other. And I think it's so important to know that. Even when I worked with kids, or if anybody's worked with addicts, I don't know if any of you guys work with addicts, we know one of the number one predictors of relapse is going back to the community you started in. And this goes back to anything we can do to make those communities stronger so that it's not the communities that are bringing people down.
That's beautifully put, all of you. Wonderful job. I really love how we just keep centering around how much it's so important and how important it is to really come back and use our area, use our community, which isn't just your family. It starts in your household, starts in your block, your street, your city, your county, your country, continent, etc. So really like how you guys all brought that together, which lines up for our next question for the panel. What changes or updates would you like to see in the growth of your community and related healthcare system or systems? So where can we grow? Where can we thrive?
Oh, all right. So solutions.
Thank you, Jessica, for going first.
Yes, I'll volunteer. The most immediate solution that comes to mind to me is a restructuring of how we fund community care access. So being in private practice, there was such a desire to be able to serve our community with a little more freedom. I think a lot of us move into private practice in order to have that creative freedom. But the reimbursement rates to go into people's homes, into their environments is just not there. There's not compensation for drive time to and from. Reimbursement rates sometimes are more difficult to receive when you change the location of service. Sometimes malpractice insurance doesn't cover you going into those environments. So going into people's communities, we learn a lot about their culture, their background, what type of resources they have available. We get a really good sense, diagnostically, just maybe what their needs are. Get a bigger picture perspective. So that'd be number one. Increase reimbursement rates, yes. Or state or federal funding that can actually go into these smaller businesses. Maybe that's idealistic, but that's one thing I would love to see. I'd also love to see us having more opportunities for education that would teach us ways to bring this indigenous culture back into the workplace, back into families. I went to this tribal affiliation workshop one time. That was amazing. And one of the takeaways from it was we got into small groups and it was pretty spontaneous where we kind of went up to each other and we were invited, make a commitment to at least 3 people from this conference that you're going to be in the same tribe as each other and that you're going to be in touch with each other at least once a week for a year. I made some of the most lifelong new Ohana or Hanai family from that conference that today have been my natural mentors that are not related to me. And it actually helped me start my business because I was able to lean on some of their wisdom. It exposed me to an enormous amount of information and resourcing that I would not have been able to get from my nuclear family or anybody that was in my support system. And we learned some tools on just how to form those commitments with each other so that we could actually, in modern day, right here, right today, make a connection with another individual or a few other individuals where we could be a resource to each other. And it was a win because these individuals actually happened to be aging. And I was able to have some exchange in that relationship of offering, support, like delivering some crutches or, something that was a real practical need that I was more physically able to do. And it was absolutely beautiful. And I would love to see that type of model and teaching and learning opportunities happen in our world because I think it would help our culture and our workplace and our family life and environment in enormous ways.
Okay. Yes, that. So I'm trying to figure out my and. I think it back to the access piece. So we know reimbursement is a huge issue in general. A lot of us who go into private practice are private pay related to that. And there's a lot of guilt within our field. I think Hello? Okay. For being private pay, because most people go into this field because they want to help, right? So you want to help, and in graduate school, most of us essentially have to, and hopefully very willingly, work with underserved populations. So then you leave and you realize that you have this choice between being this amazing individual who doesn't ever buy a home or anything yourself, or, changing your rate plan. And that could be like a really, in general, we aren't all conditioned to feel good about that choice. So I think that in of itself, I think just access in general. And so some of it's how we pay people. Some of it's just making it easier for people to get that access, because the type of mental health help we need varies. And I think it's okay that there's reimbursement differences depending on what's being offered, essentially. But there's not enough of us, I think, despite the fact that we have this wonderful group up here. But I also think there's just the stigma piece. And again, things are getting better, but even when the care is there, do people feel comfortable accessing that care? Do they feel comfortable saying, hey, I think honestly, even saying I need help in and of itself is problematic. I think everybody could use a therapist. Is there like anybody in here who doesn't enjoy venting to their friend every once in a while? Does anybody in here maybe complain about work a little too often to their spouse? And they're like, please stop doing that, right? Even the help thing implies there's something wrong. It is back to the health community piece. The healthier we are as individuals, the healthier our community is. You don't need to wait until you feel broken. And I think things are improving. I talk to these 25-year-olds and they're just full of insight. It's absolutely amazing. It's fantastic. But I think it's important we keep those conversations going, that in school, and some schools have started working in some mental health learning components. And I've also seen some people pushing back on that. But I think it's really important that we have that language, as early as humanly possible, so that people know everybody struggles. Everybody has hard days. Everybody has stress. Everybody has anxiety. Everybody has periods in their life when they feel depressed, and that's actually normal. And addressing it is how we stay healthy as an individual and as a community, not suppressing it or essentially making it really hard for people to access, either literally or just from a psychological standpoint, because we can't bring ourselves to do so.
I absolutely agree with you. I'll touch on that for just one second with the community component and integrating the discussion into the academic setting, especially at a young age, because I think a lot of youth, more so now, are starting to understand that your emotions, your brain are also a part of your physical health. These things are all included. They're all in one. And so I love how you guys touched on that. And then family of origin versus family of choice. You created a family of choice that you've really learned to depend on and work with and thrive with. And that's a beautiful thing. Go ahead.
Yeah, well, in terms of how best we serve the communities and what are the challenges, as a physician, it begins with the realization that every patient is unique. And then also every community is unique. And there's no way you can have the all fit all on the communities. So for effective and sustainable communities healthcare delivery, it starts with assessing what does the community need. You have to involve them from the start of what you are planning to bring into that community, which means they have to be participatory in the decisions. They have to have that sense of ownership of the initiative you are trying to bring. And with that, once you effectively engage them, like we do with the mobile clinics, before ever we go down to the community, we have to do a bit of sit down together, plan with them to see what we are bringing so that they understand what we are coming to bring, and they buy into it. They have that sense of ownership in terms of the resources we are bringing. And what are the resources that we need? Resources means material, financial, and human resources. And once you have that sense of ownership from the community in terms of the healthcare delivery, the services you bring, it augurs for a lot more for sustainability. It augurs for them to accept it, because I work in almost all countries in Sub-Saharan Africa and also in Europe with lots of migrant populations, and every population is unique. And once we identify that from the onset, our initiative will be well grounded. Be it a community of diabetic from different cultural backgrounds, you have to harness that cultural differences, and with that, your initiative will be much more well grounded. And even when you give information to them, it is normally said that information well adapted and culturally acceptable is very inspiring. If we transform that into knowledge, it's one of the greatest forces for change, behavioral changes. So you have to accept the cultural background. Somebody mentioned this as well, as Jessica said, in context of healthcare delivery, especially at the community level. So you have to tap into that. And with that, you can have a lot of sustainability in what you do. And this is one of the greatest strengths of my network. Engaging with the community, be it the community of the service providers, community of doctors, providing the services, nurses, and everybody in terms of opinion leaders, etc. It's very essential to connect with the community so that your initiatives will be sustainable and acceptable.
And I followed you again. I know in our practice, everything is a we, us, ours. I always tell clients, I'm honored to be taking this walk with you, this journey, but it is your journey. As providers, we try to help illuminate the road and maybe move a couple things out of the way, but ultimately the journey is theirs. The lessons are in the challenge and teaching them they are strong enough, they can do it. And once they finally feel that experience, they just come to life. It's amazing. I know in our community or in our practice, it was designed to look upper scale, but we work with any population. It doesn't matter, where you come from, where you've been. I've worked with gang members. I've worked with murderers. This is where I was more in community care. But even now, I work with our state government access. And I don't care. I just don't care if they have insurance, don't have insurance. I do have some cash pay. But I think it doesn't matter what your socioeconomics is. Every single person deserves to have top quality care. I know I talked with Charles about they have Doctors Without Borders, but how come we don't have Mental Health Without Borders? Because I would love just to travel and help people and teach them. Everybody, we know what we're not good at. So I'm very strength-based, and I'm not going to tell a client or validate, oh yeah, it's not a great area for you. I don't. Everybody's great at something, and we grow and we build off of that strength. I even do a pro bono for caretakers, because a lot of times they can't afford the care because everything's going into taking care of whether it's a parent or a child, or and they need, of all people, they need to have that support because they feel alone. They don't have money to take care of themselves or do care. And so that's our way of trying to give back to our community and offer that help. And usually it's 6 months to a year, depending on the client. Some pick up real fast and they're like, okay, thank you. I want to leave that space for somebody else now, which is a beautiful thing to see somebody not be selfish and offer that up. But anyway, I don't know, hopefully, Charles, maybe we need to talk.
I think you just came up for an idea for the group Therapists Without Borders. If anyone wants to run with it, come see Christine.
The Red Cross has a disaster mental health unit you can join potentially.
Therapists Without Borders.
Okay. I support it.
It's less borders, yeah. It's actually pretty amazing. I looked into that one too. So as we describe our communities we work with, the work that we do, and how much you guys are all obviously givers to the community and the work that you do, how do you practice self-care? What does that look like for you? Because as providers, we give, and we need to take care of ourselves as well. So what does that balance look like? And what does that look like also in your workplace or your organization? How do you help your fellow colleagues or providers or clinicians, doctors, manage that and practice that? And we're going to start with you, Christine.
Thanks.
You're welcome.
In the practice, the last 2 weeks of the year, every single year, whether it's admin, clinical, doesn't matter, we shut down for the last 2 weeks every year because I want staff to shut off, click off of work. It takes about a week to do that anyway, but I want them to be with their family, their friends. Mental health it's a tough field, and it has a pretty high burnout rate too if you're not taking care of yourself. And I'm going to own this. I think community care is so much easier than self-care. But I know I was really good at it, but I also realized as you grow and you change as an individual, your self-care needs are going to also change. And so I'm in the process. I am working on this. I don't work overnights anymore and ridiculous hours. I'm trying to be mindful of that. but it comes back to that saying, like the oxygen mask, pretty much you got to put it on before you can help others. If I'm burnt out, I can't lead by example. I'm always going to practice what you preach. There is no growth in comfort. And that's how I ended up here doing all those things for staff. But it's, so that for me is important, but it's, family is very important. I don't have a lot of family, but what I do have is so very important. And this moment, we don't get back. So whether we take for granted a lot of, next week, or I'll do this tomorrow, but we don't have that guarantee. And I learned at a very young age, my mother died a week before my birthday, and it is instilled in me, like, okay, I told her I was going to come next weekend, and I didn't because she wasn't there anymore. So it's the whole don't go to bed mad, don't, those type of things, don't put everything off until tomorrow because you know what, we might not have that. So part of my self-care is like sitting in silence and thinking about what am I grateful. Every morning I wake up and I say, hey, beautiful girl, today's going to be great. We're going to do awesome. We're going to do the best that we can be today. And at night, I try to reflect on my day because I'm human and I've had to learn to accept that I don't handle everything properly, but I learn to reflect on it, grow from it, and move forward with the lessons learned. And I've learned to leave the baggage behind because we're not meant to carry that. And I try to teach this to clients. So it's like telling clients, I'm not going to tell them something that I'm not going to try myself or haven't done or haven't seen work. But I'm also very organic. Our conversations are very organic. I mean, I do trauma therapy and there's like, wow, I never left trauma therapy laughing. But it's trying to teach them that to be kind to ourselves is a self-care for me, and learning that it's okay to not know everything. I usually get, well, you said, oh, you're right. I'm like, really? But it's just learning to be kind to ourselves. I know we just ran a series, a campaign called Love Yourself, and there was like, I think 4 or 5 different pieces to it. But so we got a lot of good feedback on that. So teaching self-care, I get self-care, I love to see people smile, just simple little things.
Thank you.
Well, I very much support what you said.
Hard to follow.
And yeah, building upon that, I think with colleagues, we should be supportive to one another. It's very important. Our work should complement the work of others. It's nice to have a healthy competition. And I normally say, people don't create competition. You should not fear one, but you should be supportive to one another. And if you go to institutions or countries or the UN or WHO, acknowledge them that they are the custodian. If a country is the Minister of Health, they are the custodian of the health of that country. You are there to complement your effort. If you have organizations, you are working in the same field, the real winners are the end users, the patients. Have a healthy competition, but be supportive to one another. Because if you synergize your efforts, you can maximize your output. So it's always nice to be supportive, and I do it more in our network. If I have organizations, you can become individual membership or organization member of my network, and I support you to the best of my ability. And I use my United Nations status also in Geneva. Every year I bring organizations from all over the globe so that we can sit together. I call it Experience Sharing Forum. So we can share our knowledge, we can build upon our successes, and share the challenges people had, so that somebody doesn't need to walk through that difficult path again. Because at the end of the day, it's the end user that are the real winners. So that's why I said working as a team, supporting one another is very crucial. And have a healthy competition, but always be supportive. At the end of the day, go in for the grants. When you win the grants, you do your work, you do your study, share the results with others, so that at least they can build upon what you've done. And with that, the world can be a better place. That's why in our network, we say together we can make it happen. Nobody's got the magic bullet to solve all the problems of the poor or low and middle income countries. We all share the same identity, which is why we take up the challenge to help. Thank you.
Okay, beautiful, so inspiring. Caring for the self. So we're not just human doers, we're actually human beings first. So when I think of self-care, I've built much of my world around this shift, because this world that we live in requires a lot of doing, and that can be very exhausting. So taking those moments to just notice the self and what the needs are. For me, it's a daily practice of some sort, whatever the need is, just like food and oxygen and rest is doing something that is nourishing to the self at a core level, the mind, body, spirit, like connecting to that deeper layer, that core. And I've built my whole life around this. I get to go to work now with an entire team where in the interview process, that's a conversation we have. How do you take care of yourself? Because nobody else can do it for you, but you. And you have a value for mindful living, paying attention to the present moment, suspending for a moment, just simply practicing accepting. And that becomes a common bond. And so when we see somebody who's, really stressed or overwhelmed or going through a really difficult life event, we're not just pushing them to plow through those experiences. We're actually inviting a pause for a moment to come up with some ideas or give that some space and time to just be human. And it's been kind of amazing that it's actually propelled this a lot more productivity and on the back end by pausing on the front end. We start our meetings with some type of mindfulness-based practice, and it's 5, 10, 15 minutes out of our 45-minute time together, but we're all synced up. When our minds are scattered or in multiple directions, it can be really difficult to have a meeting where you actually are taking a team somewhere, but when you're all kind of synchronized through a breathing technique or some type of shared focus or intention, it's pretty powerful. So that's what self-care means to me, and that's how I've incorporated it into my entire life, including the people I get to go to work with every day.
I love that. I love the team meeting, beginning, getting all sunk up. I love that so much. So for me, it's my nails. It's like literal. My self-care is quite literal at this point in my life. And trying to remember. So the nice thing about things like this is you notice when you don't do it because they grow out. So, and in all seriousness, I'm a big fan of what I consider positive self-sabotage, which is essentially when you set yourself up to not be able to fail. So, some practices like mindful meditation is extremely effective and it's wonderful. But if you don't have, let's say, somewhere you're checking it off, which most people don't, it might be easy to skip it today. I'm tired. And then I skip it tomorrow. And now it's been 2 weeks since I did it. So for me, I do have little things like my nails. So anybody who gets their nails done, they quite literally grow out, they chip, they can hurt. You're kind of forced to be now I have to go sit somewhere and just sit there. And I can't really do anything. And actually the one I picked has no reception coincidentally. So I can't even really do work on my phone, which is something I'm guilty of. And I talk to my clients about this too, because sometimes, and the only reason I agree with everything they said, I'm just not reiterating it because you guys did a really good job. So this is a yes and. But I have clients where I'm sometimes self-care is you don't look like you've had a haircut in 1,000 years. Sometimes the superficial stuff matters because that's also back to looking in the mirror, right? It's, do I look in the mirror and like myself? And of course, your appearance shouldn't be why you like yourself, but we all grew up in the same world and we all have those same biases and it does. So, doing those things that literally make you feel good matter too. And I think that's that whole person approach, which I think all of us, yes, therapists are the worst. Doctors are too. Doctors are terrible patients, right? But remembering that is important when it comes to how I do it in my practice. Sort of similar to you in the interview process, it's part of it. Less of a conversation, which probably has a lot to do with my A-type personality. I actually mandate a lunch break after 3 clients. So 3, you have, 4, it can be 4, but after that you have to. Part of this is because in reality, if I see 6 people in a row, and I'm sure you guys run into this. I swear clients all have a text chain and they're hey, let's have a crisis all at the same time. And if you've had 3 or 4 people in a row who are all in crisis, it's exhausting for you as a therapist. You're holding that space. So I tell them, hey, even if you don't think you need it, because therapists are terrible at self-care, so they never think they need a break. Even if you don't, you have to. You have to. And we actually space out our sessions. We have a 15-minute break in between. Some of that is to allow room for when you have that client that needs the extra 10 minutes. So we're not having to say I have to stop. But some of it, I tell my therapist, you should be able to get a cup of coffee, go pee. These are basic life needs that a lot of times we forget to stop and make time for. And then you're kind of always racing the clock just to take care of your basic needs. So within our group, and I am a big believer, one of you said it about the whole, if we take care of ourselves, we take better care of our clients. I really think we have a high rate of burnout, and without fail, that is going to impact how we care for each other as well. The end.
That was so amazing. You guys are just great. You touch on like every point I could possibly think of, and I just love how wonderful you collaborate on this. We have about 5 minutes on our little timer here, so we wanted to leave some extra time for any questions from the group. We'd love to hear a wonderful, concise question that can be answered. So if anyone has anything they'd like to share, we would be happy to have you up to the microphone in the center and just tap, tap to make sure it works.
Right. Hello. Hey.
Perfect.
So thank you so much for an amazing talk. Honestly, it's phenomenal because I think this is one of these aspects that we just do not talk enough about or have much of a focus on in the day-to-day. My question to you guys is, this is the common question out there, which is, we know social media has a lot of negative effects on patients, people, and well-being. I'm going to ask a different form of that. What do you think are the positives in relation to social media and what we consume? Not just the negatives of it. We're fairly, and I think acutely aware of the problems that it brings up. But what are some of the positives that you may see in relation to using?
Animal friend videos. Dogs and ducklings. Yep. No, seriously though. I know you're already going to say what I'm going to say, so I'm going to give it to you. But no, well, so I think we can choose to try and make the algorithm work for us, and have those positive exposures. For me, it might be ducks and puppies, but also, there's so many therapists and life coaches out there putting positive things out on social media. And so I think we can seek those things out, and sort of, it goes back to what we expose ourselves to. In the last panel, our moderator was talking about how she doesn't want to watch the news because it's so negative. And so similarly, what do you open on your phone? I mean, how many of us go to the bathroom and we just peek at our phone and like 20 minutes later, our family's like, yeah, right. Right. And if you have fallen into the negative feed, that can really have an impact on you. Just the same as being, even like the music you choose to listen to can have this effect. Everything in our environment ultimately impacts, even just subconsciously, kind of our baseline at that moment. So I definitely think it can be used for good, so to speak. Unfortunately, you probably have to be very, very, very tactical, because in case anybody's missed this in some of the recent news and everything, the algorithms are designed to feed you things that you react to emotionally. And your strongest emotional reactions are usually negative. So we tend to stay on negative content longer. We could psychoanalyze the heck out of that one, but it just is a fact. So there might be 10 videos, and if only one of them is negative, that might seem like a good ratio. But if you spend more time on that negative one, guess what you're going to get more of? So again, it's, curating our own content as much as possible, maybe like specifically following people and trying to only look at the things you follow and not just what it recommends, things like that.
I agree with you, being mindful of what we're listening to, what we're putting into our brains every day, what we're reading, hearing, everything. Go ahead.
I just wanted to piggyback on that again, using the algorithms to your own favor by what you give your attention to. And that does take discipline. So because I noticed that in my own life, I started this 100 Mindful Day challenge and wrote like 100 days of content of daily inspirations and put that out there as a free gift to the world for those who are trying to retrain their mindset to focus differently on what content they are giving their attention to. So thanks for bringing that up.
What's your username for them to follow?
Mm-hmm. It is at 100 Mindful Days Project, Instagram, on Facebook. Yeah, Jessica Brazil. And if you just go to one of those and you can DM me and I can add you to, it's a free daily inspiration email series right now. I'm working on turning it into other methods, but we do have to be intentional with what we are we're feeding our minds with as much as what we're ingesting physically in our bodies. And social media is actually, we can use that to our advantage if we use the algorithms right. We just have to retrain how much attention we're giving to that different content. So thanks for bringing that up.
At Concierge Psychologist. And I don't have any other cool thing to add to that. Except for me.
I would say actually, I use it to my advantage because I don't watch news or TV or anything just because of all the negative but I do. LinkedIn is actually my go-to, and I'm always looking for positive, strength-based. And I use these things, and I'll save them, and I'll have clients come in. We'll have a session, and they'll be on. I'm like, oh, hold on, and I'll send it to them. I'm like, see, look, it's on LinkedIn. It must be true. So but it's learning. The mind is so powerful. It believes what we tell it, and what most people don't understand is that the brain doesn't understand don't. So if there is your favorite food sitting right there, and I say don't eat that, what do you see in your mind?
Eat that.
Exactly. So I tell people, okay, when they come in like, oh, I want to lose weight and I'm not going to eat this and I'm not going to eat that and it's all sugar stuff, cupcakes, and I'm like, what are you craving right now? Like everything I just said. I'm like, okay, so let's manipulate the brain. And of course I get checked like, oh, that's rewiring. I'm like, let's just call it what it is. We're manipulating it, okay? So it's like, I'm going to eat lean foods or whatever, the vegetables and all this great stuff. And they actually start craving that. And I actually learned, I used to crave, when I'd crave sugar, I love chocolate, or I used to. And I think, oh, I want to have some chocolate. But I learned that if I eat strawberries, the organic ones, because those are really good. And I was never an organic person until this, or kiwi, it actually makes that craving go away. And now I don't crave chocolate. I'm kind of bummed.
I never want to undo that.
What,
I don't.
right?
No.
I look at it, I'm like, yeah, I don't want that. I'll eat a kiwi or something, But it's amazing if you learn how your brain works, because everybody's different. If you learn how to work it and manipulate it to do like reverse psychology on your own brain, it's pretty great. But it's so it's a great question.
Last words.
Yeah, well, I think most of what I want to say has been said. But I say it's a very good question you pose. At times, the greatest challenge of the social media and even the Google, or the information, the negativity. And even as colleagues, physicians, when patients come to you, they've read all the negative things on the internet and they throw it at you. Well, it's your ability to actually dissect and tear apart, take it apart bit by bit, so that at the end of the day, the reality will hit them if you have the chance. That's it. But it's something we have to live with, and it's the positive side of it. Unfortunately, these other negative confounding factors we have to factor into our life and see. We had a conversation last night about kids and the thing they read on the internet, etc. And it's your ability as a parent to actually see, or as a physician, as the opinion leader in the community, to see how you can dissect this information and try to, like during the COVID-19, and there was so many theories there. In Switzerland, we had to get together the migrant community to have an open discussion, because these are the opinion leaders who are taking this information back to the other communities, so that we have an information sharing even about COVID-19 and what was on the media. There were so many wrong things that even as a scientist or physician, you feel frustrated that people can put up such things. But it is the world we live in, so you have to take a lot of patience to dissect and take them apart, so that the reality will hit the person, rather than don't be confrontational, don't say don't do it, but rather than let's look at this information and see what's the merits about it. You may be right, you can start with that, and then slowly you dissect it to make sure that at the end of the day they see, okay, it's all false. Sorry, that Java, it's all fake. Okay, thank you.
Thank you guys so much. That was such a wonderful discussion. Thank you for the great question.
Thank you to our panelists and to our moderator for a wonderful and exceptional, insightful panel.